Migraines are recurring headaches that are painful and oftentimes debilitating, but many do not need to tolerate the misery. One local neurologist says knowing your triggers and being proactive with medication can help relieve suffering. When Dr. Loveneet Singh meets his patient, Alma Martinez,
how are you feeling today?
They go over her log, a schedule she keeps to monitor what sets off her headaches.
He taught me that how I have to make sure that I schedule everything, how to actually recognize what my triggers are for migraines, because I didn't know that before.
For Alma, she says sleep deprivation and stress are the two leading factors as to why she gets painful migraines. The stress of the coronavirus pandemic and the stay-at-home order has also added a load to the working mom's already busy life.
I really noticed that migraines were really impacting the quality of my life. You know, they were impacting how I was taking care of my children, how I was performing at work, how I felt about myself, because it was debilitating, exhausting. And
Alma believes she has been suffering from migraines for at least 20 years, but it was 6 months ago when she was finally referred to a neurologist, Dr. Loveneet Singh.
I have like this spot in my eye. It starts in the center and it turns into a big like half moon kaleidoscope, and it moves, and as soon as it moves it's like an irresistible headache. So that really scared me because I first thought I was going blind.
Dr. Singh explains there are various types of migraines, including ones with or without auras, otherwise described as natural phenomena.
Phenomena can be visual, which are positive phenomena, such as you have flickering lights in your eyes, you have shaggy lines in your eyes, your vision is like that. And they can be negative when you have blind spots, when you lose vision.
According to the American Migraine Foundation, about a quarter of people who experience a migraine will have aura. It's the kind Alma suffers from.
It affects the quality of our life. Quality means your personal life, your professional life. People call in sick from work because they have migraines.
Dr. Singh says it's important people keep a log of what led to their migraine that day. A simple lifestyle change can be the answer to cutting the headaches out.
There are simple triggers with migraines can have: sleep deprivation, undersleeping and oversleeping. Both can trigger a migraine. When you have issues like dietary changes, those can happen to be migraines. So it's very commonly noted people who skip meals. There are some products which you eat can trigger a migraine: MSG, cocoa.
People can take over-the-counter NSAIDs or non-steroidal anti-inflammatory drugs like acetaminophen or ibuprofen to help relieve their migraine pain. Dr. Singh also suggests a triptan drug, which can quiet down overactive pain nerves. Some patients like Alma will be prescribed medication to prevent the migraines from occurring or reducing the pain if they occur.
It's worked very well for me. My preventative medication, I have a shot once a month, and I feel the headache coming on, but it goes away, which is amazing.
Alma says she used to get anywhere between 15 to 20 migraines a month. Now she barely gets 2.
Put your hands up straight.
She's grateful she received guidance from Dr. Singh, who offers advice to all who may be suffering from migraines.
You don't let the headaches to go loose for running for 3-4 hours and then say, okay, I'm going to take the medication at the time. And then for the abortive medications, if you have more than 5 to 7 headaches a month, it's always good to be on an abortive medication so that it continues to improve.
Abortive medications are used to stop the headache process and prevent symptoms of migraines, including pain, nausea, sound and light sensitivity, and are most effective when used at the first sign of a migraine. Always consult with your doctor before starting a new medication or if you have questions.